Okay, this is a video that I've been meaning to make for a while because about half the time my job is doing head and neck surgical oncology and skull-based surgery at a university center, and half my time is doing general ENT at a VA hospital. And during the time I'm doing general ENT, one of the most common, if not the most common thing that people come in to see me for is nasal congestion. And these people come in and they say, I've been told I have sinusitis by some doctor in the past, um, or they've had septal surgery to try to fix their nasal congestion. It hasn't worked, and essentially, most of the people don't have sinusitis. They actually have rhinitis, either allergic rhinitis or non-allergic rhinitis. And these things are very often confused by even by other doctors, rhinitis and sinusitis, because the symptoms are very similar. They both have drainage, they both have nasal congestion, they both have feelings of pressure and headache. So they seem very similar. So this is a very good article that I found, um, just kind of basically going over the, allergic rhinitis. And so in the background here, they talk about how this is obviously written by a group out of Sweden. So they talk about in Sweden. In Sweden, 25% of the people in Sweden have allergic rhinitis. I believe that is fairly similar in the United States as well. So it's a lot, like 1 in 4 people, and it's not life-threatening or anything, but it causes a lot of problems. It's very annoying. People can't sleep because their nasal congestion is usually worse at night when they lay down, and they feel kind of foggy, and their head is always congested, and they feel pressure. It affects, they feel like their ears are plugged all the time as well. And so because the nose and the ears and the sinuses and the eustachian tube are all connected, what affects one you generally tends to affect the other. And it's very difficult because, most of these people, because it's a common disease, they've been treated before, and they've tried all the medications. It's still not working. And there's this mixed rhinitis, which is both allergic and non-allergic rhinitis, which is probably a very common entity. A lot of the people probably have uh, both entities going on. And so basically, a brief overview of how this thing works is you have some antigen, and in the case of non-allergic rhinitis, something else, things like cold air, or, smoke, or um, certain scents can set it off. Or just, we can't even figure out what the trigger is. People just feel like that all the time. And what it is you have an antigen. If it is allergic rhinitis, it binds this Ig antibody. So there's many different kinds of antibodies. There's IgE, IgA, IgG, IgM. IgE happens to be the antibody that is associated with fighting off parasites. And there's a very interesting story and relationship between parasites and allergic diseases, and maybe I'll make a video about that sometime in the future. It's a kind of a fun story. But anyways, the Ig binds, and there's this thing called a mast cell, and the mast cell releases all these things, leukotrienes and histamines, and that goes to the cells of your nasal cavity, and then that's when they swell and they make mucus, and they feel itchy. And then later on, they recruit these Th2 lymphocytes and eosinophils and basophils, and these kind of get recruited into the nose, and it makes it so that in the future, people are congested kind of all the time, and they're also more reactive. And so the major things pharmacologically that we can do in terms of drugs are things that probably most people have already tried. And by the time they come to ENT clinic, they've all tried these. So this is oral antihistamines. These are things like Benadryl, Allegra, claritin, um, Zyrtec. So these are the oral antihistamines, and they act to block here. They block the histamine release from the mast cells. They block the histamines from affecting the nose, the nasal cells. Then there's intranasal antihistamines. These are like azolastine, or the trade name is astelin. That's another thing. Same thing. It works as a histamine blocker. And then the mainstay of treatment is intranasal corticosteroids. This is like flonase, rhinocort, nasacort. Flonase, the generic name is fluticasone, and so everyone has tried that. And then the most recent drug is Singulair or montelukast. These are leukotriene receptor antagonists. So they block this. They block the other molecule that's released by the mast cells. So anyway, most people have tried one or more of these, and they're just not getting relief. Some people it works great. Other people it doesn't work that great. And in terms of what modern medicine has, these four categories, that's all we got. That and uh, allergy shots, which are kind of a totally different thing. And your doctor will probably talk to you about allergy shots if that's something that might work for you. So if these drugs aren't working, are there other things that we can do to try to help this pretty aggravating problem? And yeah, there is. There's a bunch of research that talks about various things, but we don't talk about them much because they're not drugs, they're not things that can be prescribed, and they're not easy to do. So let's talk about first the relationship between allergic rhinitis and also non-allergic rhinitis and body mass index or obesity. So basically, this is a study where they looked at an observational study where they looked at over a period of 6 months, 55 cases of allergic rhinitis were selected. The patients were investigated by eosinophil count. So remember, that's that cell that's one of these cells that are recruited. And so they found that there was a positive correlation between absolute eosinophil count and BMI with a very high p-value. So it means very highly correlated. So they conclude that patients with high BMI are more prone to allergic rhinitis and have higher absolute eosinophil counts. So that's one study. There's multiple studies, so we could go over many studies looking at the two. And so why is it that high BMI causes people to have worse allergies? Because um, fat tissue releases a bunch of things that cause inflammation. Um, so both allergic disorders and obesity keep increasing in industrialized countries. Very true. Industrialized countries, United States, Sweden, other places that they're talking about. So they said, there has been a high association between obesity and allergic related diseases. And so what they did is they do a review and they show that there's a bunch of they call them adipokines. These are, cytokines or um, cell signaling molecules that fat cells release that predispose people to have asthma and allergic rhinitis. So there are lots of similar articles, and I'll link all these in the description of this video if you want to read them yourselves. But it's pretty clear that these fats, having a lot of fatty tissue in your body, makes you have more allergic rhinitis. This is a study in mice. Obviously, humans are not mice, so you can't directly correlate the two, but it is useful. And what they find that these adipose-derived stem cells, so these are stem cells that are in fatty tissue, they can migrate to the nasal mucosa, and they they um, they increase the immune response to allergens. So yeah, so number one, like almost every other chronic disease that we have in the United States, losing weight will help you with your rhinitis symptoms. Mm, Um, that may not be the only reason because obviously there are thin people that have allergic rhinitis, but you know, losing weight is not going to have any bad side effects for most people. So that's something that can definitely be done, but obviously this is not something that's easy to do. Next is dietary changes. And so um, there's an association between food allergies and allergic rhinitis. So one thing that I recommend, and several of my colleagues also recommend, is what's called an elimination diet. And what we recommend is try to find different foods and see if that food may be the trigger for the allergic rhinitis or even the non-allergic rhinitis. And the most common foods are dairy, eggs, peanuts, wheat, soy, tree nuts, and shellfish. These are the most common things. I also recommend elimination of like other kinds of meat, chicken, um, beef, pork, cured meats. But you just try one at a time because try to go cold turkey and all of them is probably not a diet that is easily sustainable for most people. So I just say like for 2 weeks avoid all dairy, and then at the end of the 2 weeks just load up on a bunch of dairy and see if you notice any difference. If that's not if you notice no difference by doing that, then go to eggs and then peanuts and then wheat and then chicken and then beef, whatever. But over the course of several weeks, you can check a bunch of different foods and see if that may be the trigger for your allergies. So another thing that has been looked in quite often is the association between diet and allergies. And so in this one, they found out that living in an urbanized area and eating lots of fish, meat, liver, deep fried foods was associated with higher asthma and allergic rhinitis. In this one, they show that eating a lot of vegetables was helpful. So having a vegetable-rich diet was helpful in allergic rhinitis. This one shows the protective effects of vegetables and a Mediterranean diet among children in Crete. So this is a study out of Crete, and they found here that 80% of the children ate fresh fruit and 68% ate vegetables at least twice a day. Intake of grapes, oranges, apples, and fresh tomatoes. These had no association with atopy, but they were protective for wheezing and rhinitis. So the results of this study suggest the beneficial effect of commonly consumed fruits, uh, nuts, and vegetables in adherence to traditional Mediterranean diet during childhood. And so here's another one. Mediterranean diet is associated with reduced asthma and rhinitis in Mexican children. So they did the same thing. They did a cross-sectional study of 1,476 children in the Mexicali region of Mexico. And their conclusion was our findings suggest a protective effect of following a healthy dietary pattern on asthma and allergic rhinitis in Mexican children. And what do they mean by a Mediterranean diet? That is a diet that is very high in, let me see if they define it here. Hmm. Okay, they don't define it very well. I think they reference these papers, but essentially a Mediterranean diet is a diet that is full in whole foods, very low, like no processed foods, mostly vegetables, high in whole grains and nuts and legumes, which are beans. So lots of beans, lots of vegetables, fresh fruits, whole grains, olive oil. Um, and I didn't look up the studies on this, but there are many studies that show that high processed sugars and high fat diets are very pro-inflammatory. So those are also the things that you want to avoid. So far we have lose weight. Number two is elimination diet. Number three is a diet that is very high in vegetables, whole grains, nuts, and beans, and fresh fruits, and very low in all processed foods, simple sugars, and bad fats, which are most fats. And so this is the opposite of the average American diet. We eat a lot of pizza and ice cream and hot dogs and hamburgers and sandwiches, a lot of processed carbohydrates, lots of sugar, and lots of fat and deep fried foods. Those are all the foods that are going to lead to allergies, and that's why we see such an increase in allergies in America. Okay, lastly, exercise. So exercise decreases interleukin-4 and TNF alpha in patients with allergic rhinitis. These are things that cause worse allergy symptoms. Um, Nasal airway response to exercise. They show that with exercise, the nasal airway opens up. And you can try this yourself. If you feel like your nose is really stuffy, go and do like 20 or 30 push-ups. You will notice that the congestion goes away temporarily. If you exercise consistently over a long period of time, that will make an effect on your nasal airway over a long period of time. This is another study where they had a group of people basically do a lot of exercise, actually, like 4 hours a day of hiking or skiing. And they said that recreational winter exercise at moderately cold temperatures reduced allergic airway inflammation. So uh, they got people that had known allergies or asthma, and then they had them do 4 hours of hiking or skiing a day for over a 10-day period, and they noticed a dramatic increase in nasal airway. And then lastly, there's a couple of studies that show that curcumin, this is a substance found in turmeric, which is a common spice, mostly found in Indian cuisine, and that has effects on allergies. So, if you like Indian food, or you can cook with turmeric, that's another thing that might be helpful. So, weight loss, elimination diet that's high in whole foods, mostly vegetables, fresh fruits, whole grains, nuts, and beans, and then exercise and possibly turmeric. So these are the non-pharmacologic things that you can do to help with your allergic rhinitis and non-allergic rhinitis. And so these are the things that probably your doctor is not talking to you about, because these are things that are difficult to do. They cannot be prescribed. They're up to the patient to do. And it's not something that is an easy fix. It's something that takes a lot of time and effort and commitment on the part of the patient. But if you're one of those patients that has the time and the commitment and wants to work on their symptoms, I'll link all these studies below. You can read them yourself, and I hope that is helpful to someone.